Hello and welcome to episode 54 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is erectile dysfunction, testicular pain, groin pain with low back pain. Is there a correlation? Let's discuss it. And if you missed last episode 53, it was about the reverse hyperextension. Is it the miracle movement for low back pain? A lot of people say it is. Some people say it isn't. I give you my opinion from all angles on whether or not you should do it. And maybe you should not do it. If you heard about the reverse hyperextension before, I recommend you go listen to episode 53. But today's topic is, as I stated, about male-related genital issues, and could it possibly related to low back pain? Now, this is a topic that a lot of men and well, females as well. Females do struggle with the type of nerve-related issues that I'm going to discuss today, but this particular topic is directed towards the men. It's not really talked about a lot in, the common forums or the common videos or things like that, because not a lot of men or women like to share this type of information. But I will admit, I will probably get at least a few male clients per month that will say that since their low back pain has started, since their sciatica has started, they have also noticed some painful erections, erectile dysfunction, or testicular pain. This has become common enough to where when, a brave individual begins discussing this topic with me, and maybe how it relates to intimacy as well, that I can comfort them in saying, you know what? A lot of guys in my program right now, a lot of guys in my private Facebook group are actually struggling with this. So I want to discuss how that works. What is it coming from, and other things to look for? Because erectile dysfunction is, obviously something that is relatively common, especially in older populations, but there are some individuals out there who maybe they're just in their 30s or 40s and they're like, what? Like, this is not something I should be dealing with. Like my age, my hormone levels should be able to support, adequate, sexual function. And they don't know what's causing this. And so they're being told to go get, medication for that, but it might not be doing anything. They might even have some difficulty urinating too. This could very well be coming from your low back. And I would not be surprised at all if we determine that it is. So the way that this works, there's a nerve that branches from your lower back called the pudendal nerve. The pudendal nerve goes to all over your pelvis, innervates all over your pelvis, your pelvic floor, your perineal region, your genital region, innervates everything, because that pudendal nerve then also branches to perineal nerves, deep perineal, superficial perineal, and these obviously go to the penile region. This is why many men who have low back pain and some sciatica symptoms, sometimes they don't even have sciatica symptoms, but usually they'll be like, yeah, I get, maybe some pain around my hips, a little bit of burning in my leg, and also, you know what, Grant? I have a lot of testicular pain. Not uncommon. I have painful erections. Not uncommon. I have a hard time, becoming erect when I'm, trying to be intimate with my wife or my spouse. And that's not uncommon either. And also painful orgasms can be a thing as well. So this localized pain in the genital region very commonly is coming from the low back. It's coming from the nerves, coming from the disc that is maybe causing that irritation on those nerves. This is not an uncommon scenario. So the intention of this podcast is really to bring awareness to that, because what I don't want to happen is for you to have some low back pain that you're neglecting. Okay. Let's say you get some back pain, you're neglecting it, and you're like, whatever, it'll go away. But weeks go by, months go by, and it's not gone. And then all of a sudden you start having these issues. some of the issues that I discussed. And now you're thinking, oh gosh, now I need to go see an endocrinologist or a urologist or whatever, whoever you decide to see. And now you're being told you have a completely separate issue. Oh, well, erectile dysfunction. Okay, let's go on these drugs. Let's look at these hormones. And now you're in this confusing, race towards something that is very, very off path for you. So you're distracted. You're being led to believe that it's a separate issue that you have to work on now, when it could be very much so related to that low back pain that you've neglected. Maybe you haven't been neglecting it. Maybe you have been seeking treatment, but just haven't found the right help. Or maybe the back pain is very new, and these additional symptoms immediately started as well. These are not at all uncommon symptoms, and you need to do something about it, okay? You do not want these symptoms to increase and to spread and to get worse and to cause any further effect in this delicate region. Having proper function in these regions is very, very important in multiple aspects, multiple angles is very, very important. Females as well will experience similar symptoms. Pain with sex is a common one. Pain with sex, painful intercourse is what a lot of females will notice. Not so much painful urination. I don't hear that one very much. But most likely painful intercourse is the most common complaint I hear from my female clients who have disc and or nerve issues that are hitting this particular branch. So just remember, you could only have low back pain and pain in the genital region. You could have only leg pain and pain in the genital region, or you could have low back and leg pain and pain in the genital region. But you need to have a proper mechanical low back assessment to determine if these things are coming from the low back. So how do we do that? Well, the most common approach for these type of things is referred to as end range loading of the low back. Now, this depends on the direction of the disc that your body wants to go, okay? A lot of the type of clients that I work with are favorable to extension. I actually just put a sciatica test, which tests for an extension responsive low back individual, on my private Facebook group. I'm putting a lot more private content on my private Facebook group. This group is called RehabFix Low Back Program. I will put a link in the show notes. You should absolutely join. And I just wrote an article on sciatica down there with a step-by-step test process for you to see if your sciatica, maybe your leg symptoms, hip symptoms, or even groin symptoms will change in response to some extension-based end range loading. It's a free test that I have on my Facebook page right now. I recommend you go join that page for not only that, but for a lot of other content as well. And so with this type of audit process, we can see if immediately, I'm talking immediately, 5 minutes, your groin symptoms or leg symptoms or low back symptoms will improve. If they immediately improve, then we know you should continue that type of process and then scale it accordingly. I can't really give you an idea because it's different for each person, right? Some people might do it once a day. Some people might do it 20 times a day. It just depends, right? It depends on the kind of direction as well. If one direction is working, sometimes we might need to add in another one or change it to a different one. There's multiple variables, right? That's why I do what I do. It's why I have a job, because people need specifics. But that initial process can help us determine if the symptoms you're getting in your leg or your genital region is coming from the low back. And if it is, with that test that I have on my Facebook group, that's just one of many tests we would do. Then we know, like I said, to continue that and to progress it through the appropriate levels to achieve full load on the low back into whatever range of motion your low back ends up liking. And then you will simultaneously notice that every week those symptoms are becoming less and less and less. I've had clients where, over the first 6 weeks, they've gone from testicular pain that's constant to maybe 3 weeks in, testicular pain that's there 50% of the time, 6 weeks in, no more testicular pain. And then the leg symptoms will start to reduce as well. and then it's only low back symptoms, and then their low back is completely restored as well. That's how powerful this kind of end range loading can be for the certain type of disc issues that we deal with. Okay, it's crucial. You have to have a plan to support that. And we have to track those symptoms in those particular regions to ensure that every week we're making the right changes. So how are they moving? How are they changing? What's the rest of the leg doing? What's your back doing? And figuring out how these regions are changing will tell us if we're doing the right things. So we want to see that centralization of symptoms. We want to see the symptoms come out of the genitals, that pain come out of the genitals, the pain and symptoms come out of the leg. This is called centralization, and eventually retreat to only the low back. That is where your key to success lives. Okay? So, if you have any interest in continuing to learn how to do this, or if this is you, go join my private Facebook group. RehabFix Low Back Program is the name. Answer the questions that you will be asked, and in there, we can talk further. And if you're like, you know what, Grant, I've had these issues, I need to do something about it now. This podcast really resonates with me. And you just want to cut to the chase. You just want to get right to the source, right to the solution. Then submit an application on my website. I'll provide a link in the show notes as well as a link in my bio on my Instagram page so that you and I can work one-on-one together. You can work with my team and we'll get you the help that you are looking for and the plan that you are looking for. If you enjoyed this podcast and you learned something from it, please leave a 5-star rating and review. Also, if you're watching on YouTube, please like, comment, and subscribe. Remember to move more, move in the sun, and move in nature. And as always, thank you for listening, and have a great day.